I am the senior author on a paper by Dr. Mova, which actually got a hold of the CARIS data set. We were given approximately 2,000 profiled patients with sarcoma, and what's going to come out of that are a lot of really neat clinical trial targets. We found that sarcoma may be a disease of the loss of PTEN, which actually begins to give us a direction to go in the clinical trials. We seem to overexpress SPARC in a good majority of our cancers, which means that albumin-bound chemotherapies may actually be something that will work really well in our disease. And then on top of that, we're starting to get data out on PD-L1, which would suggest that sarcoma is another ripe area for all the hot immunotherapies that are going on right now to come into our world also. And that's just the tip of the iceberg of the things we found, but those were the major take-home points of her talk tomorrow, which is, I think, kind of exciting because when you're given such a large data set that nobody's actually looked at in this size before, at least in sarcoma, you actually begin to kind of get an idea of what may be common in a bunch of rare diseases. So what we can take forward as a group and what we may need to take forward in individual histologies may begin to play out. And so this is going to really change, hopefully, the clinical trial platforms and the targets we think about as a community. And so that's really exciting.